Mr. President.
The senator from Delaware.
Mr. President, while Senator McConnell is still here in the Senate chamber, I just want to take just a moment to follow up on his comments about the loss of Christopher Stout. My wife and I have a son of our own named Christopher. He's roughly 10 years younger than Christopher Stout at his death. And so as soon as Senator McConnell began talking about the loss of this life, it resonated to me as a father. Also resonated with me as a former Commander-in-Chief of the Delaware National Guard for 8 years when I served as governor of our state, and as a Navy veteran who served 3 tours in Southeast Asia in the Vietnam War. One of the sometimes we don't focus enough on what is being accomplished by our men, servicemen and women like Christopher Stout in their service to our country in Afghanistan. And our purpose there, our role there has been to go into a place from which the 9/11 attacks were conceived and guided that killed thousands of Americans. Our purpose is, as we draw down on our troops there, to, at the end of this year, to be down to about 9,800 troops, and roughly half that a year from now, and even fewer in the years to come. But our goal is really threefold, and that is when we leave behind not only a place that's less likely to foment and launch attacks against this country or any other country, but also we leave behind a country that can feed itself, defend itself, and govern itself. The presiding officer was Adjutant General for the state of Montana. He understands full well, having served in combat and for a long period of time, the importance of the role that the Christopher Stouts have played and the reverence that we hold for them and for their service in life and beyond. I'd also hasten to add, in following up on the minority leader's comments, there are some things that we had in the military. I served 5 years active duty, 18 reserve as a P-3 aircraft naval flight officer and later as a mission commander. And there were some things that we had in the military that, frankly, a lot of people in this country haven't had for too many years. Until last year, about 40 million people in this country did not have health care. They did not have access to health care. And we have changed that. We've changed that dramatically. Does everybody have access to affordable health care today? No. But we no longer have 40 million people anxious to get access to health care. The number's been cut by roughly a quarter. We'll reduce it again this year and again next year. But among the things that we had in the military is an annual physical. The idea, actually, we get an annual, and your birthday month. My birthday month is January. I got my first annual physical, I think, when I was 17 from a Navy doc, and I got them for years and years after that. A lot of people in this country, including people on Medicare, they could have lived to be 105. And until about 3 years ago, with the adoption of the Affordable Care Act, they got one annual physical paid for by Medicare when they turned 65 and joined Medicare. That was it. It's called Welcome to Medicare Physical. They could have lived another 40 years. They wouldn't have gotten another one paid for by Medicare. The reason why the military provides physicals for its members, active duty and reserve, is in order to catch problems, healthcare problems, when they're small, when they can be treated. And we do this to save money. I served in the military and in and out of military bases all over the country, all over the world. And almost in every one of them, there was not just a doctor and corpsman, Navy corpsman and so forth, but there was a place to go to if you had a problem, you needed medical attention, you could get it, a clinic. And today we have thousands of clinics all over this country where people, whether they have 5 cents or $5 or $50 to their name, they have health care coverage or not, they can go get a primary health care. They can get primary health care. And we have grown dramatically access to people for primary health care in places all over America, not just Delaware, but all the other 49 states as well. One of the other things that they have there's been a lot of attention on the VA, some of the very disappointing things we've learned from Phoenix and other places like that in terms of waiting lists. They need to be addressed, and they will. But one of the great things the VA came up with, 15 years or more ago, was electronic healthcare records. electronic healthcare records. When I was in the Navy on active duty, and my presiding officer may remember, we used to carry around with us something a little bit, about roughly this size. It was a manila folder, a brown manila folder. And it included my medical records for years. From the time I got my first physical and 17-year-old Navy ROTC midshipman until my last one. Well, people on active duty don't carry these around anymore. We have electronic health records, pioneered by the VA, and now we have them in the Department of Defense. And the reason why we have them is because it enables us to better coordinate the delivery of health care to people who otherwise may not have it. The Affordable Care Act actually introduces, for the first time for millions of people, electronic health care records. Not for them to carry around or access necessarily, although in some cases they can, but the people that are providing care for them to do it in a better coordinated, smarter way, a more cost-effective way. Better results for less money. And the other thing that we had in the military was medicine. If you needed to take medicine, prescription medicines or that sort of thing, you could actually get a medicine that was going to help you get well or help you stay well, be productive. And we adopted about 7 or 8 years ago the Medicare Part D, Medicare Part D prescription drug program in Medicare, which has turned out to be, I think, a great success. Although they had a big problem with it when people would fall into a donut hole. And a lot of folks who got pretty good coverage for maybe the first half of the year, they would lose their coverage and have to pay, didn't get any help from Medicare Part D. And we started filling the donut hole with the passage of the Affordable Care Act. And over the next 6, 7 years, we'll complete filling that donut hole, and people won't fall off a cliff, Medicare Part D participant, like they have been, because of what's in the Affordable Care Act. And you know who pays for that? Well, the pharmaceutical companies pay for that, not the taxpayers. The pharmaceutical companies pay for that expansion, making Medicare Part D a good program, cost-effective, under budget. 85% of the people who use it like it. All those things actually coincide with the benefits that we enjoyed in the military. And they're made part and parcel for more people through the adoption of the Affordable Care Act. Are there problems with the Affordable Care Act? Sure there are. Are there things that we need to fix? Sure we should. Will Slyvia Mathews Burwell help us to fix those? She'll provide great leadership. She and I, interestingly enough, our lives were sort of intertwined in a strange way. We found out when I first met her. I called Erskine Bowles. I learned over a year ago the president had nominated Slyvia Mathews Burwell to be, the President Obama had nominated her to be OMB director. And I noticed she'd worked in the Clinton White House with Erskine Bowles when he was chief of staff to President Clinton, the second term. So I called Erskine. I said, tell me about Slyvia Mathews Burwell. And he said, I'll tell you about Slyvia Mathews Burwell. He said, I've known people as smart as Slyvia. I've known people that are as good at working with other people as Slyvia. I've known people as good as Slyvia at getting things done. I've not known one person who does all three of those things as well as she does. He told me a story when she was working as Bob Rubin's right-hand person, top assistant. Bob Rubin was then the Secretary of the Treasury. President Clinton was meeting with the chief of staff, Erskine Bowles, Bob Rubin, the Secretary of the Treasury, and Bob Rubin had one of his top aides with him, Slyvia Burwell. Erskine recounts his story how the president was grilling his Treasury Secretary, Rubin, on a particular issue, and Secretary Rubin was kind of struggling to respond in an appropriate way to the president's inquiries. Slyvia Mathews Burwell, the assistant, writes a note, hands it when the president's not looking, hands it discreetly to her boss, Bob Rubin, who glances at the note and then re-engages the president on the issue. And the president says, that is a brilliant insight. That is a really brilliant insight, Bob. Erskine Bowles, not to be deterred, says to the president, said, Mr. President, Slyvia wrote a note and gave it to him. That's how he was able to give you that answer. And if I had people as smart as Slyvia on my staff, I'd look a lot smarter too. And but she was covered herself with glory in those years at the White House. Finished up. This is a gal who grew up in Hinton, West Virginia, a little coal mining town on the New River, where I lived when I was 4 years old. Her husband, Stephen, proposed to her at the Bluestone Dam on the New River, where my grandfather and father used to take me as a little boy to fish. She's later graduated from Hinton High School, public high school, a little coal mining town. Where did she go to school? She went to Harvard. And after that, she went, where'd she go to school? Well, she was a Rhodes Scholar. She went to Oxford. And she came out and she went to work for a great consulting company, Kenzie and Company. Ends up working in the White House, doing all kinds of things during the Clinton administration, higher and higher responsibilities, ending up as deputy OMB director the last part of the year, when we actually had 4 balanced budgets in a row, if you'll recall. She knows how to manage. She knows how to manage people. She knows how to manage financial resources. And she is terrific in working with people. That's why Tom Coburn, my wingman in terms of leadership on the Senate Committee on Homeland Security and Government Affairs, he actually came along with Jay Rockefeller from West Virginia. Actually came a Republican and a Democrat to introduce her for a confirmation hearing before the Senate Finance Committee on which I served, to endorse her candidacy. I want to thank Dr. Coburn for doing that. You would expect Senator Rockefeller to do that. He's a huge fan of Sylvia for long standing. But Tom and I've only got to know her, Tom Coburn and I've only got to know her for the last year and a half, and have loved working with her. Think she's done a terrific job at OMB, and that she'll do a terrific job at the Department of Health and Human Services. I want to say a special thank you to her parents, who are still alive, who still live in Hinton, West Virginia. Just a real thank you for raising not one but 2 young women, including Sylvia's younger sister, Stephanie, and instilling the kind of values in them and the kind of education in them that have enabled them both to go on and do extraordinary things with their life. I want to say thank you to Stephen, who proposed marriage to then Sylvia Mathews at that Bluestone Dam on the New River all those years ago. I want to thank him for sharing his wife with our country. These are tough jobs, demanding jobs, some cases thankless jobs. And he's willing to take on some extra responsibilities as a dad in helping to raise their children, both under the age of 10. I think Helene's about 6, and I think Mathews may be 4 years old. And they know that their mom is changing a job. They know that she still has a job. And boy, she has. If we confirm her here today, it's a huge job. Is there work to do? Sure there is. Is there work to do in implementing the Affordable Care Act? Sure there is. Is there work to do in tweaking it and making it better? Sure there is. But I'll close with this. For my Republican friends, and I love them all, for my Republican friends who moan and groan about how the enormous burden that the Affordable Care Act is putting on the American people, let me just say this. I have a friend, you ask him, how are you doing? Here's what he says. Compared to what? Ask him how he's doing. He says, compared to what? Well, if things are so bad now with the Affordable Care Act, let's just say, well, compared to what? Here's where we were 3 or 4 years ago. The country of Japan spends 8% of their GDP on health care. 8% of gross domestic product on health care. We spend 18, and we did until recently. The Affordable Care Act, they get better results. Higher rates of longevity, lower rates of infant mortality. They arguably get better results in many respects than we did until at least a couple of years ago. And in Japan, they cover everybody. And until this year, we had about 40 million people who went to bed at night who did not have health care coverage. Now, while I regret anybody who is inconvenienced or disadvantaged at all because of the adoption of the Affordable Care Act, I regret every one of those people. But you know what? I really regret all those folks in this country, tens of millions of them, who didn't have access to health care. I really regret the fact that all those people on Medicare never got a second physical. And if we had gotten them, they'd gotten one, they would have had a much better life. I really regret all the folks in the Medicare prescription drug program, millions of senior citizens who fell into the donut hole and stopped taking their medicines and got sick, had to be hospitalized, ended up in nursing homes, cost a lot of money, and died not a happy life. I feel badly for them. My dad used to say to us, rather than just moan about problems, fix them. Fix them. And there are plenty of things that we can do to make the Affordable Care Act better. I know what they are. But the idea of saying we want to go back to where we were, that dog doesn't hunt. That's not a good thing in Delaware, and I don't think it's a good thing in Kentucky, where Governor Stephen Beshear has provided great leadership in his state to make sure that the hundreds of thousands of people who needed health care have it today, who didn't have it before. And we want to make sure that the opportunity that they've realized in that state, In those states that don't have that opportunity, they have no exchange to sign up in. They have no expansion of the Medicaid program. My hope is that they'll look to Kentucky as an example and to Delaware as an example to see what we can do for our people. Last point. Most of the people who serve here are people of faith. Some are Protestant, some are Catholic, some are Jew, some are different religions. Most people here are people of faith. And most of our sacred scriptures have a couple of things in common. One of the things they have in common is the golden rule. Our chaplain, Barry Black, who gives the opening prayer most of the days we're in session, likes to say that the golden rule is that treat other people the way we want to be treated, love thy neighbor as thyself. He says that's the Cliff Notes of the New Testament. Cliff Notes of the New Testament. As it turns out, the golden rule is the Cliff Notes of every major religion in the world. I don't care if you're Protestant, Catholic, Jew, Muslim, Hindu, Buddhist, almost all of them have something like the golden rule in their sacred scriptures. And in the New Testament, in the book of Mathews, Matthew 25, there's something that we've all heard. Not everybody knows where it came from, even that it's in the Bible. But it is. And the scripture talks about, when I was hungry, did you feed me? When I was thirsty, did you give me to drink? When I was naked, did you clothe me? When I was sick and in prison, did you come to see me? Matthew 25 doesn't say anything about when I had no health care, and when I had to depend on the emergency room for health care, when I got really sick, and ran up a big tab that somebody else had to pay for in a hospital because I was hospitalized for a while, or a long while. It doesn't say that in Matthew 25. But the intent is the same. Where were you? Well, we were here, and we voted to try to do something about it, to make sure that people did have better access to health care. And we can improve on what we've done, and we need to do that. We have a moral imperative to the least of these in our society, to look out for them, to help them look out for themselves as well. We also have a fiscal imperative given our budget constraints, to meet that moral imperative in a fiscally responsible way. Sylvia Mathews Burwell understands that as well as anybody I know. She's demonstrated that in her leadership at OMB. She will demonstrate that if we confirm her today to be the Secretary of the Department of Health and Human Services. And I hope that my colleagues, Democrat and Republican, will follow the leadership of Senator Tom Coburn, a Republican from Oklahoma, and his wingman, Tom Carper, a Democrat from Delaware, in supporting this nomination. With that, I yield back the floor and note the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.